I was previously at Hennepin Healthcare.
At the state capitol, a panel of former nurses from different hospitals.
Abbott Northwestern,
North Memorial,
St. John's, Healthies,
University of Minnesota Medical Center.
Each explaining why they left their jobs.
With the combining of 3 hospitals into one, our surgical supplies were put 2 floors down. So literally 25,000 steps in a day, running up and down stairs to get my supplies for my patient.
Unfortunately, the response did not have the seriousness that was needed to respond to the concerns that we were continually bringing up.
Their experiences are not isolated, according to this 2022 Nursing Workforce Report. The Minnesota Nurses Association surveyed almost 750 nurses and says the top 2 reasons for leaving
Had absolutely nothing to do with the pandemic. Nothing.
were hospital management and chronic short staffing. And MNA says shortages aren't happening because there aren't enough nurses around. In fact, it says the number of registered nurses went up over the past 3 years, bringing the total to around 120,000, the highest ever recorded in the state.
So it's the staffing plan that hospital management builds a budget around every single year.
They're calling on lawmakers to pass the Keeping Nurses at the Bedside Act, which they say would solve issues hospital systems created years before the pandemic began. Kaya Edwards, KARE 11 News.
Just within the last hour, the Minnesota Hospital Association released a statement saying the state is facing an unprecedented workforce crisis in healthcare, which they say they are working very hard to address. Now, they also say DEED estimates that Minnesota has 40,000 open healthcare positions. The association says, though, their most significant differences with the Minnesota Nurses Group come from the nurses' pushes for state legislation that would mandate nurse-to-patient ratios. The Hospital Association opposes that.